Hi everyone, dermatopathological fans. This is Raffaele Gianotti from the dermatopathological lab of the University of Milan, Italy. I want to show you a short webinar about COVID and skin disease. I did a long seminar 10 days ago, and today I want to show you some new cases that we have seen in the last 10 days. And the webinar will be shorter, I think roughly 20 minutes. So, let's go on. In Italy, we have 1,500,000 COVID positive patients from the beginning of the epidemic. Today, 719,000 positive patients in different stages of systemic disease, while an American paper suggests that 20% of affected people have skin-associated dermatosis, but our experience suggests roughly 10% of the affected patient could have skin dermatosis. But let's assume we got the percentage wrong and take it to 5%. This means that 39,500 patients with systemic disease could have dermatosis. The British Medical Journal in April, they wrote this paper, and they said 4/5 of cases are asymptomatic. This should mean that in Italy more than 3 million of people, 790,000 times 4 patients, could be systemic asymptomatic carriers. Could we therefore assume that 5% or less of the asymptomatic people could have dermatosis just as they had a simple cold and asked for a dermatological examination due to the appearance of the skin disease? Oh, well, I'm sure the answer is yes, totally. But have a look to the global number. At the end of November, more than 60 million of people were infected, with 1,500,000 deaths. And this is sad and very strange that if you match COVID and skin on PubMed, only 852 papers. This means that dermatologists write papers only about dermatosis in PCR-positive systemic patients. There are terrific numbers, and that's why dermatitis with strange histopathological patterns come onto the plate of my microscope every week. And we wrote a paper because we thought we get the patient 0 with dermatological skin disease. In November 19, I showed this case in my previous webinar. She is a young woman with this urticaria lesion where we found immunohistochemistry positivity and fish positivity in the eccrine gland, and the histopathology is absolutely similar to the histopathology that we observe now in a positive COVID patient. Anyway, we sent the paper, and 10 days after sending the paper, 2 new papers coming from Italy appear. One was written by a group of National Cancer Institute. They investigated the presence of SARS-CoV-2 antibodies in blood sample of less than 1,000 asymptomatic individuals enrolled in a prospective lung cancer screening trial. between September 19 and March 20. Okay, they found more than 100 people with positive antibody against COVID-19. A second paper coming from North Italy, they searched with PCR the gene sequences of the virus in the wastewater, and they found it at the end of November and in December 19. This confirmed our patient as the patient 0 with the dermatosis, also because I contacted the patient and she told me that in April of this year she has IgG positivity in the blood against obviously SARS-CoV-2. But what's new? Now I show you a case I saw last week. As a 55 years old man, 10 years ago, histopathological diagnosis of dermatosis in another department. We don't have data about previous therapy, and 2 months ago he had diffuse papulonodular eruption. Look at these angiomatous nodules, and I show you the slide. Well, I was not sure about the diagnosis because it's not absolutely simple. We have some spindle cells in this area, and with the endothelial hyperplasia in this area, and vascular spaces filled with red blood cells with this funny vacuolar feature of the vessels. But look here, this enlarged glandular, equine glandular glomeruli, and go back, and we perform HHV8. It was positive, so we can suspect really it is a Kaposi sarcoma. But we perform immunohistochemistry against COVID-19, and it is positive in the equine gland here and here. I don't know what really does it mean. I don't know if there is a link between Kaposi sarcoma and COVID-19 infection, and in the future I hope it will be clear the pathogenetic mechanism of this new virus. Anyway, this is for sure a patient who has a Kaposi HHV8 positive, and he get the COVID infection, probably asymptomatic, because the patient is in really good health. In the last, my previous webinar, I showed this collection of kids. They have this lesion, this papillonecrotic lesion, and we call the PNH90 dermatitis of childhood, COVID-19 papillonecrotic hemorrhagic dermatitis of childhood, and I showed you the histopathology. All the cases was positive with immunohistochemistry. In this case, it's a mini-pernio-like pattern, and in another case we observed a band-like infiltration with the hemorrhagic area. It's very similar to erythema multiforme. And Dr. Cutrone, coming from Vicenza, who is a town in North Italy, he sent me the clinical picture and the slide of this young patient, 9 years old boy, and the dermatologist thought at the first glance Mucha-Habermann disease. For 1 month the patient was affected. I show you the slide, and as you can see here, this slide is absolutely different, does not match in any feature with Mucha-Habermann, but it's clearly a mini pernio pattern. Look, the dermal ducts with a heavy infiltration around it. This heavy infiltration around blood vessels with probably a very early stage of thrombi formation. So I'm sure this is a new PNH19 case. But have a look at this 37 years old man, Mucha-Habermann for 5 months, but he has IgG antibody against SARS-CoV-2 virus in the blood, and the clinical picture is absolutely similar to what we observe in the kids I showed you in the last picture. Look at the slide. Well, it's slightly different because this is a mixed pattern. It's a band-like infiltration, roughly similar to erythema multiforme, but look at these vessels, enlarged vessels with the early phase of thrombi. Have a look here. So this huge eccrine gland, glomeruli. So you are looking a skin slide of COVID-19 confirmed patient, and so this confirm the fact that these people may have a clinical lesion very close to Mucha-Habermann disease, but with a completely different histopathological pattern. And this is a 33 years old man, PCR positive at March. This means PCR negativity in April, and later, after the negativity, maculopapular eruption on the leg. Okay, this is a mini pernio that particularly involves the vessels with early thrombus formation and heavy perivascular lymphocytic cuff around the vessels. So this is a very common skin biopsy feature when you are looking a slide of a COVID-19 positive patient. In this case, we don't have eccrine gland, and so we do not perform immunohistochemistry. Asymptomatic carriers undergone to dermosurgical excision for benign or malignant lesion. It's fake or true? I will show you very quickly 4 cases. In 2 of these cases we perform immunohistochemistry and we found positivity in eccrine gland. This is a 32 years old woman. She has a keloid because 2 years ago she undergone surgical excision of benign nevi, a benign neoplasm. But look at here, a massive, incredible microthrombi in the deep dermis, and also here. And look in the upper part of the dermis, this funny enlarged vessels with vacuoles in the serum. This is very common observation in our cases. I don't know what does it mean. This means that something in the vessel happens, and this is an asymptomatic careers, and probably the manipulation of the biopsy excision induced something in the vessels, or the virus induced something in the coagulation cascade. This is a ruptured cyst in an asymptomatic young woman, and look at this thrombi, diffuse thrombi, and look at this. These are a huge extravasation, red blood cell extravasation, and here for sure microthrombi in small vessels. This is a basal cell carcinoma. Look on the edge, vacuoles in the blood vessels, and dermatosis hyperplasia with the vessels engulfed by blood cells. Here with this funny staked appearance of the red blood cells, vacuoles in the serum, and I think early phase of thrombi formation. And look also very close to the glandular glomeruli, the engulfed red blood cells. And the last, same business. This is an angiofibroma, and look at here. This is an healthy patient. I think this is an early phase of thrombi formation. But let's speak about the magician ability of this virus. I show you. This is a 55 years old woman, COVID-19 infection. She was treated at home in quarantine with this drug. This is a non-steroid drug. And 10 days after pharyngeal swab negativity, she had the onset of this sudden onset of this pustular dermatosis. Look at the face. This is impressive coalition papules and pustules, and also on the arm and on the sternum. Have a look at the slide. I'm sorry, you will not find nothing special except some probably sign of the passage of the virus some weeks before. These vacuoles in the vessels, some eosinophils, roughly heavy perivascular infiltration, and look at the other side of the punch. This is subcorneal pustula, and some enlarged and engulfed vessels by red blood cells. So I was not able to write it's a COVID-19 disease, skin disease. So I checked in literature, and I found the same drug induced an acute generalized exanthematous pustulosis. This paper was written in 9 years ago, but some colleague from Saudi Arabia wrote recently this paper about a COVID-19 patient with acute generalized exanthematous pustulosis after the COVID infection, and the patient was treated with a huge number of different drugs, from steroid, interferon, antibiotics, but the clinical picture was very similar to the lady I showed with you. And this is a young girl. She was PCR positive on October 26 with mild systemic and pulmonary symptoms. She was treated with steroid and 2 different antibiotics. Then she was negative in November the 7th, and 1 week later she developed this pustulosis on the head and on the back. So we think these pustulosis are really related to drug treatment, and there is no link between the COVID-19 infection. This is a funny case because it's 48-year-old woman, maculopapular eruption for 2 months, and on a tight, this corimbiform appearance. And at the first glance, I thought, this could be our friend SARS-CoV-2 virus with a new pattern. And have a look, the slide. There is a massive infiltration in the upper part and the part of the dermis, and the infiltration involved eccrine glands, some enlarged blood vessels, and heavy perivascular lymphocytic cuff, and also here. But if you go closer, you will realize that most of these cells are plasma cells, and the same happens in the deep part of the punch around eccrine glands, plasma cells. So I started to suspect a different disease, and in fact the patient performed a serological test for syphilis, and this is a beautiful case of late stage of secondary syphilis. Why I show you these last cases? Because SARS-CoV-2 is really a chameleon and is a very tough opponent. It mimics the common dermatosis, but he'll cheat you. When you think it's right in front of your oculars, it is not there. So please don't forget that all the 1,000 authentic dermatoses described in the sacred dermatological tests still exist, and this will be our next step challenge. Don't miss a classical dermatosis for a COVID-19 associated dermatosis. I finish my webinar. I hope you enjoy it, and I say you a huge hello from Milan, Italy. See you next time. Bye.